I do
Yeah.
have another I do have another question from the chat, and this is related to provincial issue, but there is a federal angle to this too. Is and the question is anything happening in Nanaimo to increase long-term no or low-cost mental health services? Barron's Road and Brooks Landing are vital, but crisis-based. And secondly, what are we doing in Nanaimo to increase accessibility to social workers? There is a long-term shortage of teams dedicated to individuals who are homeless.
Well, that's a huge, and thank you whoever brings that up, because you obviously understand the issues, and also that you have compassion around both the stress on the healthcare providers because of the huge need, and also we have to advocate for solutions. So I'll just talk very quickly, and it may not be what people are wanting to hear about, but one of the things we are sitting on is the Health and Housing Task Force at the city, and it's a City of Nanaimo task force. I'm on there, the Chamber of Commerce, obviously many service providers who work both with housing and health issues, including mental health issues. Island Health sits on that Health and Housing Task Force. You can Google either on our United Way or through the Homeless Coalition, Nanaimo Homeless Coalition, or the City of Nanaimo. And so we've been working for over a year now through the Health and Housing Task Force to figure out how many units do we need for homeless, and the point in time counts are part of that. But also, just housing people is not the solution. You also have to have other supports, particularly given the massive opioid crisis that we've been facing, and sadly through COVID, we've had an escalation of deaths and a crisis on the opioid side. So what we're working on is something called a coordinated access system, and we're working with a consultant, Dr. Alina Turner, who has driven this process with Medicine Hat, Kelowna, other communities. And so probably by September, October, we'll have a report that's coming out of the Health and Housing Task Force that says, here's what we see we need in terms of the additional number of supportive housing, but also how can we change how the service providers work together, Island Health, BC Housing, and the nonprofit sector, to support the huge number of folks who have mental health issues or opioid crisis or opioid